The COVID-19 pandemic has impacted the lives of millions of Canadians, both here in Ottawa and across the country.
Many of us have missed spending time with our loved ones, our friends, our colleagues, or we've struggled to balance working at home with family life. And this is especially true for families who have small children and the children haven't been able to go to school. It's been a very different experience. Ces sentiments sont normaux en période de changement et d'incertitude. Vous n'êtes pas seul.
These unprecedented times have presented additional challenges for people living with different health conditions, including substance use disorders. Access to treatment and support has changed as more services deliver care virtually. Add to that the changes to daily routines and social isolation, it can feel as if life has been turned upside down. Know this, you are not alone.
1 in 10 Canadians are experiencing harms due to substance use today. People who are your friends, your family members, your co-workers, your neighbors. For some people, frequent and regular drug use can lead to health harms and changes in the brain, resulting in a substance use disorder. The research tells us that these changes in brain function affect a person's ability to control impulses. Substance use disorder is a health condition, like any other health condition. It is a result of different factors and different experiences in one's life. It is not a moral failing, nor is it a choice.
The evidence says they often experience stigma and discrimination, which can lead to some people to internalizing these feelings. This means they don't reach out for help. Feelings of judgment, shame, and fear often set in. They may feel that they don't deserve help.
Everything seems a lot more confusing than it was previously, and reaching out for help in the past has always been a challenge, but it's even more so now, because if you don't know where or how to get help, it can be a really difficult time and you can feel isolated.
Now, more than ever, people who use drugs and people who are living with health conditions need kindness, compassion, and support, especially when they seek out help.
We are all doing our best to navigate the many changes in all of our lives. So as we each play our part to flatten the curve and reduce the spread of COVID-19 in Canada, please remember this.
We each take different journeys through life. We each have our own stories to tell. Let's try to understand each other. Let's try to understand each other's stories.
At this time, we ask that you not judge each other, that you not judge yourself, that you be kind, that you be compassionate. Reach out to one another with a kind word. Let's look out for one another. We can do this.
Here in Ottawa, we are working collectively to help break down barriers for all of our citizens living with extra challenges during this difficult time. Even though we are apart, we are all in this together, stronger together. Compassion begins with us.